And thank you so much for joining today. This is Regina with Benevest, and we're going to go ahead and get started. At today's webinar at 10 a.m., we're going to be going over the ACA sales process flow for agents and brokers. This training is exclusive to Benevest agents only. So we're very excited to get everyone ready for open enrollment. We will be holding breakout webinars to cover more items, and you will be able to find that information inside of your All Access portal. So let's go ahead and get started. So today's outline for the training, we're going to go over step 1, qualifying clients. Client consent, that is new this year. Step 2, qualifying client. Step 3, quote and go over the tax credit subsidy, the different enrollment platforms. Step 4, setting your expectations for the clients. Step 5, payment and uploading documentation. A phone script. So if any of you have clients that you help over the phone, we will provide that to you. Other helpful tips for agents, Benevest All Access membership site, and how to get the agent support from Benevest. Before you start selling, we always want to make sure that you have your CMS certification. If you have it, you can email it over to us and we can file it inside of your agent folder. Make sure you're fully onboarded. You have provided your voided check, your W-9, they both match. That way, when the commissions start coming in around February, March from the carriers, there's no delay on our end because we have your banking information and your tax document. You want to make sure that you complete contracting with all carriers. And I'm going to emphasize, before you do write any plans with the carrier in a specific state, you want to make sure you're appointed with that carrier in that state. I'm going to cover that later on. And then make sure you're registered for all of the carrier broker portals once you do become appointed. So of course, we know there's so many carriers that you are appointed with. So you want to keep that information on a spreadsheet, somewhere saved where it's secure, because you will want to access those broker portals. And I'm going to go over that in another webinar. So let's go ahead and dive right in. So open enrollment 2024, it's almost here, right? It starts November 1st to January 15th. So if you enroll your clients from November 1st to December 15th, they will be effective January 1st. If you enroll your clients from December 16th to January 15th, they will be effective February 1st. Now, come November, you can still sign clients up if they have an SEP event for an effective date of December 1st. You can sign clients up now also, but they need that SEP event. Okay, but anyone you enroll during the open enrollment for 2024 application will not start until 2024. And then here is an image of all of the carriers that we do have for ACA. Okay, our main carriers are top ones: Aetna, Ambetter, Cigna, Molina, Oscar, United Healthcare. Okay, the other ones are more local to different states. If you need any contracting, you can go ahead and put in the chat your name and our team will get that to you. An email where you can select the carriers, or you can just send us an email to office@benevest.com and we can be sure you're set up with all the carriers in the different states. Benevest is licensed in all of these states that are blue or gold. So these are all of the states. If you find a carrier in that state, let's say United Healthcare, Benevest is with United Healthcare in every single state that they're available in. Same goes with Ambetter and all of those carriers. Any state that is in gold is a state-based exchange. So be sure that you are certified in that state if you wish to sell in that state. So if you want to sell in Pennsylvania, for instance, you need to have the state-based certification. Inside of that certification, you'll learn the enrollment process for that specific state. And then again, carrier appointments. Be sure you are appointed with a carrier in a specific state before you enroll the client. So let's say we're in Kansas, for instance, you have a client, they want United Healthcare, but you're contracted with United Healthcare in Florida, that's your main state. You want to be sure that that other state, Kansas in this example, is added to your United Healthcare. So always send an email to office@Benevest, ask our team. They're prioritizing any agents that are asking for those states during open enrollment to make sure we get you that information right away. You can also find that information inside of your carrier broker portal for that carrier. Okay. The hot states for 2024 open enrollment. And this is based on different data that we receive from the carriers, where they're going to be lowest priced, where they'll have both the bronze plan and the silver plan lowest price in many areas in those states. So we have the hot states listed here: Alabama, Arizona, Florida, Georgia, Illinois, Indiana, Kansas, Kentucky, Louisiana, Maryland, and Michigan, Mississippi, Missouri, North Carolina, Ohio, Oklahoma, Pennsylvania, South Carolina, Tennessee, Texas, Virginia, and Wisconsin. So you can see here that some of them do include those state-based exchanges, and of course others are on the marketplace. Other states, we do have the carriers in those states, so we will be writing in those states, but those are not like the hot states because maybe they might have, like New Mexico, they have a carrier that you have to be a resident of New Mexico in order to be appointed, and that carrier kind of runs the state. So although we have other carriers in New Mexico, we don't have like that top carrier there because we're not residents of New Mexico. So that's why you see this hot state list here. Okay, I'll leave that on the screen so anyone can take an picture of it. And also this webinar will be recorded so you can find it in your All Access portal. Okay, now let's move on to the client consent. So this is new since June. So the client consent, you need to obtain and document receipt of consent from your clients. This is now required by CMS. You need to have this consent on file for 10 years. Okay, on the consent, it can be a generic form. There's one linked on the CMS website that was in the CMS training, and then we also have a standard consent form. So on that, you need to have the date when the consent was given, so a date field, the name of the consumer or authorized representative, so usually that's the client's name, full name, name of the agent, broker, or web broker, agency granting consent, so that's going to be your name that you were granted the consent, a description of the scope, purpose, and duration of the consent provided by the individual, so that's your generic paragraph section, and then the process in which they can rescind the consent. So phone number, phone call, email, text. Okay, I'm going to pull up the standard consent form so you can take a look at that. This you can access also in the All Access website. That's the agent broker portal that we have for Benevest agents. So this will be the client's name at the top, your name here, and then your information here. And then this is the client's information. I will be holding a full webinar in reference to consent forms. Okay, the next step is to qualify the client. So once you get the consent from the client, now you'll go into gathering their information so you can provide them with a quote. So you're going to gather the household size, who's included on their taxes. So remember, anyone on their taxes needs to be listed in the application. Does not mean that everyone needs insurance. You just need to have everyone listed. And then you'll select who needs the insurance and who doesn't. Okay, so that's who needs coverage. What is the projected income for the 2024 household? So they can kind of estimate that based on their 2023 income. Are they married? If they're married, do they file taxes together? They have to file together in order to get that tax credit. So if they're married filing separate, they may not get that subsidy because they're filing separate to kind of already maybe get more benefits. So the government won't give them more if they're filing separate. Okay. Is the household employed with a W-2 or are they self-employed? You kind of want to ask that question because if they're self-employed, they might say their income is 150,000, but then that's before expenses. So you want to kind of help them figure out what will their actual income be. What is their AGI? Does their employer offer coverage that's affordable? That's 9.12% of their annual household income. Okay, so you can calculate that. If they make 100,000, 9.12% of that. Are they a citizen? If they're not a citizen, what's their citizenship status? And you'll need to get that documentation. If someone has Medicare Part B only, they need to apply to check. Okay. And then we have different links here. So does your job offer insurance, immigration status documentation, if anyone's a full-time student, and does anyone smoke? This presentation will be clickable, so you can go through the different articles. I would say just spend about 20 minutes reading through each different article that we have on here, so that way you're prepared come open enrollment. Employer coverage. Okay, so the IRS finalized a new rule October 11th, 2022 that changed the way the affordability is determined for members of the employee's family. So before, it used to need to be affordable only the employee's price of the plan. If people added their family members, it was very expensive, but that didn't matter with affordability. Now it's only based on the employee's pricing. So beginning in 2023, if a consumer has an offer of employer coverage that extends to the family members, the affordability of the coverage for the family members will be based on the family premium amount, not the amount the employee must pay for self-only coverage. Okay, so that will be based on the 9.12 for the plan. Okay, so it needs to be affordable. And then who is included in the income? So verify their household information with the client. Are you single, married? If they're single, that's super easy application. If they're married, you're going to ask if they file their taxes together, and then you'll list them all in the household. And then do they claim any dependents? And then do any of the dependents need coverage? Usually if anyone's under 19, they have Medicaid or Healthy Kids, CHIP. So you will still enter them into the application if they file them on their taxes, but you will say that they have Medicaid or CHIP, and you will not include them within getting the health insurance plan. All members on the taxes need to be inputted into the application, okay? And then who needs the coverage? And then this article here leads to who to include in the household. I made a chart. So I took this information, made it in a chart. We'll send that out to you, and you could have that printed at your desk for a quick reference. Okay. So for example, let's go through some scenarios. If it's a single person, super easy. That's one person on the application, one person enrolling in the health insurance. Let's say it's a husband and wife. They both need insurance. That's two people in the insurance plan. Let's say husband and wife, they file taxes together. Only the husband needs insurance. So that's two people inside the application, and only the husband needs the health insurance. So that plan is a one-person plan. Let's say it's three people in the household. Husband and wife need insurance, and the child does not. Three people on the application, two people on the health insurance plan. When the commissions come in for your policies that you write, let's say based on the last example, husband and wife need insurance and one child in the household, but the child doesn't need insurance. That's two members, two per member per month. That's two members. You're not getting paid for the third. The child doesn't need insurance. They already have insurance. So that's a household of three with two people needing coverage. What is included as income? So W-2 or self-employed. Remember, if it's someone that's self-employed, you'll help them to figure out their income after their deductions. Use what's included for the income chart, and we'll have another training going over the full income chart. And then, does the client have any deductions? Child support will not count as a deduction. Alimony, yes. If it's on their taxes, child support, no. Okay, let's go ahead. And this is how to estimate your income. This is another good article to read. What's included as income. This one I printed out as a chart as well. We will send that to you. It's good to have that on your desk. And the income chart is here. And again, we will have a separate training to go over the income chart. You will want to have this printed in front of you. And by the time you go through everything before the open enrollment starts, you'll kind of have this numbers memorized, not the exact number, but an estimate of the number. So you can just quickly rant it off to the clients. Okay. Again, the income chart, and I'll just leave that there so you can take a quick screenshot. But again, we'll be sending the information out. Okay, now you'll want to start filling out the income form. If you have an income form online, if you have one by paper, if you're using an enrollment platform, you'll start to want to gather the client information. So to help you get through the busy parts of open enrollment season, what I like to do is I like to fill out a separate intake. Although inside of the enrollment platforms, you can fill everything out, that's great. But one time I was doing that and my computer decided to restart. Computers do that, or they like to update or what have you. So instead of asking the client again for, oh, can you provide me the social security number of three people in your household and their names and everything again, I just like to take it down on a separate piece of paper. That way I'm not looking like I'm working inefficiently because I have everything. So I'm working during the enrollment season. There's clients maybe in my enrollment center. They're waiting for me. I'm having phone calls coming in of clients that want to sign up. So I'm taking my intakes that I fill out. I go over the plan and everything with the client, get it all situated, write it on my intake. Those I process at a later date, a later time that day. That's called data entry, that admin work. I'm not going to miss sales and things like that during the office hours, during my call hours. I will intake data entry later on, okay? That way you won't be missing any one during that busy time, okay? And then the intake will also help protect you if a client says they never gave you the information. You have it all written down. On the intake, what I also do is I put the date and the time that I spoke with the client if it's something over the phone. And again, in the separate intake webinar that we'll be hosting later today, we'll go over that information with you. If the person is in front of me, of course, I have them sign everything. Step 3, quote and go over the tax credit. So now you have all their information. You're going to go over the tax credit with the information that you plugged in. So you can do the quoting inside of your enrollment platform. Some agents use healthcare.gov/C plans, whatever works best for you. Quote the client and explain that all family members must be included on the application, but you're only apply for coverage to those that need it. Then you're going to explain the tax credit, the subsidy. So if they currently have Obamacare, you're going to also let them know that come January, towards the end of January, you'll receive a 1095 tax form for your current insurance, like you do 1099 or W-2 from your job. So that 1095 tax form, make sure you give that to your accountant. So this is just setting them up so they know come January, they're going to get that, not to throw it away. Then if they do get that, then they're not going to call you because you kind of explained it already. They might, but okay. And then you're going to start to go over the plans and explain the benefits. You're going to start with the bronze plan, the lowest cost one that offers a PCP copay. So one that has a primary office visit with a copay. Okay. Some of them, a lot of the bronze are pay into your deductible, but you'll find some where there's a copay. If the lowest price one is free and it's paid into deductible, and then let's say this PCP copay one is $15, offer the free one, but explain to them that they need to pay into the deductible for each visit. And then you can go over the $15 one where they have the copay for the doctor. And then after you go over the silver plans, starting with the lowest price plan, of course, you're going to discuss plans for the carriers you are appointed with. Okay, so let's say you're not appointed with Florida Blue, you're going to kind of skip over that carrier. You can touch on it, but you can let them know about the network and things like that for the My Blue plan. Enrollment platform. So a lot of agents, they use one or the other enrollment platform. They either use Benefit Align or they use Health Sherpa. So Benefit Align, it's $300 per year, unlimited applications, or $150 for the open enrollment only. If you are in Benevest lead program, this platform is required. Okay. This is approved enhanced direct enrollment with CMS. FFM certified agents, you do not need to access the marketplace to process an application. It is recommended that you access the marketplace to view the plans and programs and upload the documents directly to the marketplace, but you can now also upload them within Benefit Align and you'll get that receipt that the item was uploaded. You'll have a CRM agent back office and the client receives an enrollment email. Why do some agents use an enrollment platform where they have to make a payment for it? Benefit Align is a software company, not an insurance agency. So some agents feel more comfortable using a software platform. Health Sherpa is a software platform for enrollments, but they're also an insurance agency. Health Sherpa offers free unlimited applications. Again, this is approved enhanced direct enrollment with CMS. You'll process the application, submit follow-ups, and track your status without needing to go to the marketplace. You also get the back office. The client receives an enrollment email, and then we have a agent setup and resource guide. There's also a webinar training for both Benefit Align and Health Sherpa. They'll be scheduled and you'll be able to find them in your All Access, the recordings. Okay, step 4 is setting your expectations. So you're going to explain to the client what to expect in the weeks leading up to January 1st if you sign them up before December 16th. So the marketplace, you'll let them know that they'll receive an email or a letter from the marketplace. This letter was generated at the moment when you input their application. So it will mention on that letter they need to enroll in a plan. You're going to let them know you already enrolled them in a plan. It will also let them know the documentation that is required. You'll reach back out to them to gather that information if you process the intake later on that day. The insurance carrier, they need to make their monthly premium payment. So anyone that's a free plan, those are the best clients, right? Because they're free, they don't need to make payment. But you're going to reach out to your clients before January 1st to make sure they make their payment. I always tell my clients, I'm going to be reaching out to you before the holidays to make your payment if they didn't provide the payment information at the time of enrollment, but try to get that payment before the holidays come. So roughly the first week of December up to maybe the second week of December, but definitely before the holidays. Once payment is made, the carrier will issue them a member ID card within 2 weeks. Some of the portals you're able now to access the member ID card and you can send it to the client, but usually they'll get it by mail. If someone didn't get it and then they call you and ask you, then at that point I would send it to them, but I wouldn't go into the portals and start sending it to all of the clients. I would focus on getting more clients enrolled. Okay. And then you'll ask the client if they have any questions. Okay, for the payment and upload of documentation, so always assist the client with making the first binder payment. At that time, they're able to register for the carrier portal where they can see all of their claims, make their payment, find doctors and whatnot. And then upload client documentation to the marketplace. This is due within 90 days of the application date. So if someone gives me their documentation, I'm not going to upload it right at that moment. I will upload it later when I'm processing the intakes. But remember, it's not, if you're signing people up from November 1st to December 15th, you will not need to upload those documents until February. So you do have the 90 days. So make sure you're focused on sale time versus doing that admin data entry. When uploading documents, include the applicant's printed name, their state, and application ID. So the application ID number, the FFM ID number, is inside the marketplace application. You can also see that in the enrollment platform. Okay. Make sure to include that on each page that they send in. So if they do give you, let's say their W-2, you're going to want to put, and I always do it in pencil so I can erase it, the application number on the top of that, and then always put the primary person's name on that, and then the state that they're in. And then they still may receive letters from the marketplace about their documentation. The marketplace has gotten much better with not sending out so much because they're processing it. And then if they have it, they're not going to send another letter. Before they just kept sending letters, so clients would get a little bit confused. But when I upload something for a client, I just send them a text, uploaded it, and I take a screenshot of the portal so that they see that. And then I have that in reference in a text with them as well, in case we need to dispute it with the marketplace. Okay, within 3 to 5 days, you'll view the carrier's back office to be sure your client is listed in your book of business. So during the enrollment season, it's a little bit hard to go and do that. But when you have time, let's say on the weekend, you'll log into the broker portal and just make sure all your clients are listed in there. And then you'll also be able to see if they made payment, their member ID numbers, and much more information for the client. And then many of you do use a client log to keep track of all of your clients. On a spreadsheet, you can update that as well. Okay, the phone script. So we use this for our in-house inbound calls, outbound calls. So this is available to you as well. This is going to help you to save time because in the beginning, that's when you want to qualify to see even if they have income, maybe they don't have income. You don't want to find that out 10 minutes into the call. You want to find that out in the beginning. So that's why we have it all in an easy to use script for you. That way you can focus on making sure you're getting the most clients enrolled. Other helpful tips for agents. So try to get the clients to text you. That's an easy form of communication. That way, let's say you're enrolling someone, you have someone on the phone, you're processing. If a client texts you, no worries. You don't need to look at that exact moment. Nothing is on fire. So you'll look at those later on when you have time. But clients texting you will help you to save a lot of time. Florida did not expand Medicaid, so anyone below the income level will not qualify for the tax credit. Remember, anyone can apply for insurance and enroll in insurance, but if they're not getting that tax credit because they don't have the income, they're going to be paying the full price for the insurance. If someone doesn't have income, then clearly they're not going to be able to afford to pay full price for the insurance. So a lot of times local hospitals have hospital insurance that they can try to apply for depending where they live. So you can recommend that to someone. And then if you want, you can have the marketplace call your client call the marketplace and authorize you for 1 year. This way, if they ever have any problems, if they move or anything, you can call the marketplace at any time for them. So if they call the marketplace to authorize you on their behalf, this is not taking place as the consent form. This is just something different. This way, if they have any troubles, they can just send you a text and you can take care of it for them. Usually it's best the agent does take care of any issues for the client. That way, number one, the client doesn't mess up their application. And number two, you can guarantee that your MPN is on the application. Because if the client called in, the marketplace or the client might have it removed, and then you won't be compensated anymore for that client. And a client cannot have Obamacare and Medicare, only if they have Medicare Part B. And a client cannot have Obamacare and Medicaid. If they have Medicare, Medicaid specially needy Medicaid, then they can have Obamacare. But you'll fill that in inside the application. Call clients in the month of January to confirm that they received their ID card and plan package. Remind them to email you any documentations that are due. And if you didn't go over dental insurance or vision insurance, life insurance, things like that, you can go over it on the call with them. So remember, the open enrollment is until January 15th. January 16th, it's finished. So then you will start to call your clients, getting their documents and things like that. This is a Benevest All Access membership site. Anyone that is an active Benevest agent with 3 ACA carrier appointments or more has access to the membership site. Inside of here, you will be able to find a schedule of all of the trainings that we have, upcoming trainings. You can access training webinar recordings, the full recordings inside of here. And then we're loading in different carrier resources for 2024. So instead of going to each carrier portal to pull those, we have them all inside of here for you. And then you can also request different marketing tools that we provide for our agents. So landing pages, if you have an office that you want listed, you can request all of that inside of this one site. So everyone should have access. Again, if you have 3 or more ACA appointed carriers with us, you'll have access to this site. And then here is our support information, so you can get in contact with us. You can give us a call anytime. You can call us or text us on our local phone number here. And then anytime you can email us 24/7. The team this month, they're working extra hours, making sure everyone is set for open enrollment. So any questions that you have, please send them now. Any contracting that you need, please send in now. That way, come November, everything is already situated and you're off and running with getting your enrollment done. During open enrollment, if you have something urgent, please, in the subject line, put quick ACA question. That way our team knows to prioritize those emails, making sure we're getting you the information right away. Okay? Hopefully we can get it right away if it's something urgent and not general emails are people using the subject line, so we get to it. So try, if it's something urgent, do quick ACA question in the subject line. And then you can schedule a call with our contracting team if you have any questions on contracting. If you have any questions in reference to being an agent or anything like that, you can schedule a call with our agent relations team. And then if you have any questions on the lead program, about a landing page, you can schedule a call with the marketing team. And then, of course, you have access to insureuniversity.com. It's just a public website, but on there you will not find the full webinar recordings. So you will need to access those in all access. Any questions? I'm looking here at the chat. So someone wants to be part of the lead program. When will you receive access to Benefit Align and Ring Central? Okay, if anyone is in the lead program, we'll have a separate webinar for that. But let me go ahead and answer your question. So if you're in the lead program or have requests to be in it, you'll first have to go through Podia and pass the test that we have. The test covers questions on the different software that's used for the lead program, different like ACA questions, so we can be sure that you know the basics. And then we have to go through your contracting and make sure you're contracted with all of the carriers underneath Benevest and that your commissions are paid to Benevest for some carriers. Once all of that is set, then you will be given access to the lead software and the phone system. Once you write to clients, that's when your Benefit Align will be turned on, because you will not have to pay for Benefit Align if you are in the lead program. Okay, any other questions? What's the calculation for 9.12? So let me go back to that slide. Okay, if the job offers job-based insurance and the calculation. Okay, so number one, that the plan has to be affordable. That's where it has to be less than 9.12 of your household income. And it has to meet the minimum standards. Some companies, they offer like MEC plans. Those are not minimum standards, so they need to offer that. So let me go ahead and help you with the calculation. Let me get my calculator. Hold on. Okay, so let's say I'm bringing a note over here. Okay, let's say a client makes 50,000 for the year times 9.12% equals 4,560 for the year. You could just take the 4,560 divided by 12 months is 380 a month. So the employee cannot pay more than that a month for the insurance, and it has to be based on the lowest priced plan. So in group insurance, usually there's 3 plan options available: low, medium, high. So the low plan cannot be more than 380 a month. Okay. What are the carriers that are paid through Benevest? Okay, so I'm going to go off the top of my head. So Ambetter, what happens with commissions? So the carrier will pay us commissions for your policies, the agent commissions. Number one, the client has to make payment in order for the carrier to make the payment. Number two, the client has to make payment before the carrier's processing payment date, We don't know what those dates are, but let's say the client needs to make payment around the 1st to the 5th in order for the carrier to pay out if they pay out towards the end of the month. So let's say, and better, they pay the first full Friday of the month, for example. So that means, let's say next month, the 1st is on a Wednesday, so it's not coming that Friday, it will come the following Friday for the most part. So if the client made payment on the 1st, clearly that won't make the payment cycle because the carrier is processing everything, right? So those are the kind of payment dates. So Ambetter will come to us and we disperse it to agents. Oscar, they can pay agents directly. Some of the agents, most of them come to us and we pay it out. Cigna all comes to us and we pay that out. AvMed could pay the agents directly. Molina all comes to us and we pay that out. I'm forgetting one. United, most of that comes to us and we pay it out. You can get paid directly from United. However, you will need to do new contracting link. And since it's close to the open enrollment, I don't want to take chances with getting your appointment messed up. Once we receive the statement from the carrier, so let's say Ambetter, November 1st comes, that's a Wednesday. We'll probably receive the carrier around the 6th, 7th of the month. We get that fully processed. Once the deposit hits us, then we send it out everything to all of the agents. Usually it's within the same day. Is there a cost to the lead program? No, there's no cost to the lead program. The leads we pay out at $15 per member per month for the leads. Your own clients are paid out at the regular street rate, and any clients referred to you from any lead are paid out to you at the regular street rate. So just the leads are paid out at $15 per member per month. You do not need to keep track of that. The software for the lead program keeps track of that, so you don't have extra work with that. And if they're a referral from the lead, we don't need to know. You'll just sign them up, and that's paid to you at regular street rate. For the Benefest leads, is it for the year based only, or you will keep getting the same commission on renewals? So if you have a renewal from the lead client, the next year will be paid at the $15 per member per month. What happens with the lead program? Let's say you write 500 leads. From those 500 leads, you're going to be getting a lot of referrals. Those referrals are paid to you at regular street rate. You might get 250 extra apps from referrals, if not more. Can a voice message with date names from the consumer be used as consent? Yes, I'm going to go over that in the consent webinar, but if it's a phone call recording, you can gather that. Let's see. Okay, but is it only Ambetter? I think that's in reference to the commission question about what gets paid to us. Ambetter, Cigna, Molina, Oscar United, Aetna, those can get paid to you directly. How much do leads cost? And can you please send the pic again for the lead program? Okay, we'll have that sent out to you. And the leads, you're not paying anything for the leads. You're not paying for the enrollment platform. You're not paying for the lead program CRM. You're not paying for the phone system with unlimited calls and text. That's why we pay the leads out at the $15 per member per month, because those things are very pricey, along with the cost of generating our own leads. Okay, let's give an example of the family, the employer income. Oh, calculate the family glitch. Okay, let's see. Households with offers of employer health coverage may have opportunities for savings even if they aren't eligible before. Let's see. Let me see. Okay, let's give another calculation example. For instance, let's say the employee makes single member household 35,000 a year times 9.12% equals 3,192. That's for the year. Divided by 12 months is 266. Sometimes the employee gets paid bi-weekly or things like that, but you just need to know for the insurance, are they paying more than $266 a month for the insurance? Okay, let me go ahead and pull up another article here. Okay, the plan is considered unaffordable for an employee if the amount the employee must pay for the lowest cost self-only plan that meets the minimum value standard is more than the percentage of the worker's projected household income. So that's the 9.12. The lowest cost plan has to meet the minimum value standard for the employee, okay? And then the IRS finalized a new rule on October 11, 2022 that changed the way affordability is determined for members of the employee's family. Beginning in 2023, if a consumer has an offer of employer coverage that extends to their family, the affordability of that coverage for the family members of the employee will be based on the family premium amount, not the amount the employee must pay for self-only coverage. So if it's a family plan, that is, let's say, $800 a month. I'm just throwing a number out there. $800 a month for the family plan, okay? Let's say the employee makes the same, the 50,000, 9.12%. That's $300 a month. If the family plan is $800, then it's not affordable. Okay? If they have a family, if it's a single person and the plan, the lowest cost employee only plan is $200 a month, then it is affordable. But if they have a family and the family plan is $800, then in this case, it will not be affordable. Okay? I hope that makes sense. I'm just going to jump down to see if anyone else has any questions on the employer coverage before I get to the rest of the questions. Okay, no other questions for that. For the consent form, can I send them out a signature via DocuSign or equivalent service? Yes, that's a great idea. So I have that as an option of one of my different scenarios for the consent form, and we'll cover that in the training for the consent form. A question for the LEAD program, is it 15 per member per month for the whole year? Yeah, so as long as the client is staying active for this year, next year remaining, it's $15 per member per month. But remember, any referrals will be paid out at full rate, and you're not just going to get one referral. Those referrals will refer more customers to you. So the one lead will get you many more clients. For existing clients, do we need their consent, and do we need to send them a new consent each year? You do not need to send a new consent each year, but you would need to get their initial consent. The only way for them to take away that consent from you is if they fill out the information on the form saying that they withdraw, rescind the consent. You'll keep that consent on file for 10 years, but if they never rescinded the consent, then you still have the consent for the client. The marketplace, CMS doesn't want you to get a consent every single time because that's a little bit too much work. Is it too late to participate in the LEAD program? No, it's not too late to participate in the LEAD program. You can send an email to marketing@Benevest and let them know you're interested. Again, you'll have to go through training. We'll have to make sure you're appointed with all the carriers underneath Benevest. Why do we make sure you're appointed with all the carriers? Well, if you're not appointed with Ambetter and you have every other carrier and Ambetter is the lowest cost, then you'll be writing Ambetter. Then that's an agent losing opportunities and us investing a lot of money to get $0 back and actually go in the hole because you don't have that carrier with us. So you need all of the carriers appointed with us. And then of course you need to make sure you're maintaining certain closing ratio. So if you're taking 100 calls and you don't sell any one, don't enroll anyone, then that's not a great person in the LEAD program. We want to make sure everyone's rolling. We provide coaching to you. We listen to the calls, give you feedback so you can adjust, making sure you're selling the most applications, getting the most enrollments in. Our team could process the enrollments for you if you wish as well for the LEAD program. That way you're not working on that admin data entry and you're focused on selling. But you'll learn more about that in the LEAD trainings. Will we see our clients in a book of business in the agent portal website per carrier? Yes. So each carrier, you want to make sure you have access to your portal. With that carrier, you're registered, you're able to log in, and inside of there, you'll be able to see your book of business for each carrier. Is Ambetter give a new contract or I have to tell them I want to be aligned with Benevest? Since for Windows are closed. Just reach out to office@benevest.com. Let them know what carriers you would like, and then our team will give the details to you. How much total cost we have to pay per month for all carriers? You're not paying anything to any carriers for anything. The closing rate of the leads, let's say if I took 10 calls, I could probably get 4 people. Other people may not qualify or they'll need a call back to decide. Then later on, I will get those closed, unless if they don't have the income. Is the ACA commission always $15 per month? $15 per month, regardless of the carrier state of the LEAD program? Yes, $15 per member per month for the LEAD program. Some carriers in some states pay very little, so it kind of balances it out. For the LEAD program, you will not have to pay for Benefit Align. The consent form, it does not need to be signed every year. It does not need to be signed or filled out every time you speak to the client. It's just getting the initial consent of the client for you to help them, and then you'll keep that on file. If they send you a letter saying they don't want to give you consent anymore, then you're not going to do anything on their behalf anymore. The advantage of the LEAD program, basically you're building your book of business. How would you know which one is a referral when using the platform? If you're in the LEAD program, you're not going to put any referrals into the CRM for the LEAD program. You can enroll them in Benefit Align. You would have to enroll your own clients in Benefit Align. We just enroll the LEAD clients for you. We will know that it's not a LEAD client because their name is not inside of the LEAD program. So if it's someone that you just did and it comes in on the commission report, what we do is we filter out anyone that is a LEAD client Those are at the lead rate, and everyone else is at regular street rate. You don't need to keep track of it, we do for you. The lead program training, we're going to have it next week for the open enrollment. Right now, we have some agents that are participating in the lead program for SCPs. They're kind of more so getting their feet wet, learning the different system ins and outs, the whole enrollment process of the client from qualifying and whatnot. So it's good to get a head start. But we'll have the OEP one next week. There'll be full training on how to use the lead program. I'm paying Blue Cross Blue Shield of Texas $50 for carrier contracting. Okay, getting appointed with a carrier. Why do some carriers charge appointment fees and some do not? So once you fill out contracting, you're of course doing it on a website that the carrier has to maintain and pay for. So you fill out that contracting. Then your contracting with that carrier goes to the state of insurance department. The state of insurance, they run a background check and the carrier runs a background check and everything goes through processing. So those all, of course, have fees related to them. So some carriers pass some of that fee off to the agent. Other carriers, they don't pass it off to the agent, but they terminate agents because they don't want to keep paying those fees if the agents are not writing business for them. If I refer to another agent I get an override on her commissions. You can reach out to the agent relations team and they'll go over the agency builder with you. But anyone getting overrides, remember, overrides are more so of an agency level. The carriers are upping their requirements, so we have to up them as well. But the agent relations team will go over that with you. If anyone is a non-lead agent, you can use either Benefit Align or Health Sherpa as your enrollment platform. It's up to you, but both are open to anyone. Can I have my own fronter in the lead program? I'm not sure what that is. Is that meaning someone to answer your phone calls or things like that? We haven't really touched on that yet in the lead program. We're trying to keep it uniform for everyone. So when we get there after the trainings and everything, we can discuss. Okay, any other questions? I hope this training webinar was very informative for everyone. You were able to learn a lot of information that maybe you didn't know already, and get a refresher for information that you did know before. Again, the All Access website will have the training calendar for you. We've sent an email out with all of the dates, the different registration links, but stay informed and keep attending the webinars. You can watch the recordings. They will all be in All Access, along with all of the carrier recordings of the carrier specific trainings that were done. You can find those in there as well. Thank you so much, everyone. How do we create a Health Sherpa account? We sent you an email with an invite link, but I'll have the team send that to you and you can go ahead and create your Health Sherpa account. And then you'll also get the agent setup guide for Health Sherpa. You're welcome. Thank you all. You can keep sending in questions if you have any. I'll be on till 11:05. Okay, a few questions. How do you sign up for Benefit Align since you're in the lead program? That will already be taken care of for you. What was the two enrolled requirement you mentioned before? Okay, once you get in the lead program, you're working leads. Once you have two enrollments to get processed, have the full intake, you have the plan that the client wants. Then once you have two of those, then you'll get the Benefit Align. Benevest pays for it, so we want to make sure that you're getting through in the lead program and closing clients. There's a software that I'm purchasing that is $40 a month, and they can have a way to send the authorization to record the call and send emails year round to clients. We can send messages to clients in groups or individually. It would be best to send individually because each client will be filling out that consent form and it has PII information on there. But that's cool. What is the software? Is it PenDoc? The first two I can enroll through Health Sherpa before I qualify for Benefit Align? No, you don't need to enroll them in Health Sherpa. Our team will get them enrolled in Benefit Align once it's set up for you, which usually it's the same day. So once you have those two, our team will know because we go into the enrollment platform every day. The lead, once you have it all signed up, it will be an onboarding. You'll move it to the onboarding column, and our team knows, okay, that client is all situated. Let me get that enrollment in. That's when we go ahead and get your Benefit Align set up. No, you're not paying for Benefit Align up front. So do we pay $150 for Benefit Align up front and then be reimbursed after selling two clients? No. Once you sell those two clients, then we get it all situated and we make the payment to Benefit Align. We don't want you to jump through all like hoops and everything like that. So we try to get as much done on our end that we can for you. You're welcome. Okay, you can send in the last questions. I'm going to be hopping off in 1 minute. You're welcome. I complete the enrollment through a paper app before we have access to Benefit Line. You can do the paper intake or inside of the lead system, we have the intake there electronically under contact, and you'll be able to fill everything out there, including the plan and pricing. Then once you move it to onboard, our team will go in and get that processed for you. You're welcome. Okay, thank you all. I might see you later. I'll be on the consent form training later if you're in attendance. Have a great rest of the day. Take care.